I was excited to be asked to participate in the joint education session of ASCO AACR, focusing on HER2, along with Dennis Slayman and Pat LaRusso, and chaired by Anthony Ribas and Lori Pierce, the president of ASCO. And so my role was coming in after Dr. Slayman sort of set the ground about the biology of HER2, and then Dr. LaRusso talked about novel therapeutics that are available for targeting HER2. And then my role was to sort of look outside of breast cancer, which those two talks would be focused on, at other tumor types, specifically in GI and beyond. And so, most of my presentation was about gastroesophageal cancer, where we now know that anti-HER2 therapies are effective in HER2-driven disease, and just talking about the history of it in this disease, the current therapies that are standard, some of the reasons why we think some of the studies have failed with other agents in this subgroup, and focusing particularly therefore on molecular heterogeneity within the patient in terms of just the disease can be sort of heterogeneously HER2 amplified, some areas that are and some areas that are not, and that this can sort of account for some patients that may not derive as much benefit if the majority of their disease is not HER2 driven. And then finally, we sort of focused on things outside of gastroesophageal that are emerging, like colorectal cancer and biliary tract cancers, particularly gallbladder cancer, where HER2 amplification is a known subgroup there in each of those. And that I was highlighting current studies that have looked at anti-HER2 therapies in that space with some promise. And then last was to look outside of GI and look at other ways of becoming driven by HER2 other than gene amplification, but rather by mutation or point mutation and drivers in that setting. And focused particularly there on lung cancer, where there's been some data to show evidence of using anti-HER2 therapies for that purpose. So that was my talk and on the educational session of HER2, which was quite fun, but I think important to contrast how, although all of these diseases do have subgroups that are HER2 driven, that there are some nuanced differences between, say, the classic breast cancer story, like with heterogeneity of the disease in gastroesophageal cancer.